In this video we are going to look at the differential diagnosis of a C5 radiculopathy and suprascapular nerve entrapment.
Enroll in our online course now, link is in the video description.
Hi and welcome back to Physiotutors. When assessing a patient with neurological symptoms in the upper limb, such as decreased sensation or diminished strength, one of your hypotheses is usually cervical radiculopathy. On our channel you will find several videos that discuss the assessment of cervical radicular syndrome, such as the cluster of Wayner or peripheral neurological assessment. However, in some instances, peripheral nerve entrapments should not be disregarded as a differential diagnosis, as they can mimic symptoms of an affected cervical nerve root. So in this video we will take a look at suprascapular nerve entrapment mimicking C5 nerve root pathology. Let's first take a look at the course of the suprascapular nerve. The suprascapular nerve arises from the upper trunk of the brachial plexus that is formed by the ventral rami of nerve roots C5 and C6. It then courses across the posterior triangle of the neck, then along the superior border of the scapula, passes through the suprascapular notch under the superior transverse scapular ligament, and enters the supraspinous fossa, where it innervates the supraspinatus and infraspinatus muscle and provides sensory innervation to the shoulder joint. While injury to the nerve is pretty rare, there are several causes that may lead to injury of the suprascapular nerve. Most commonly, it occurs as a consequence of other shoulder pathology, such as an enlarged paralabral cyst following labral injury, or a large retracted rotator cuff tear resulting in a traction injury, most frequently at the suprascapular notch. Furthermore, scapular body fractures, vascular compression, and displaced implants following shoulder instability surgery are described. Most of the reports of suprascapular nerve entrapment are in volleyball players due to their repeated forceful overhead activity and susceptibility to rotator cuff injury. Patients with suprascapular nerve injury describe a dull aching pain in the shoulder and scapular region, which may radiate to the upper arm. Similarly, one of the first symptoms of C5 radicular syndrome is scapular pain in the suprascapular region, which occurs in around 50% of cases. While both patients with a C5 radiculopathy and patients with suprascapular nerve entrapment will have weakness and, in severe cases, atrophy of shoulder muscles, the differentiating factor is that these signs are limited to the infra- and supraspinatus muscles in scapular nerve entrapment. With a C5 radiculopathy, you would expect weakness in the biceps, deltoid, and to a certain degree pectoralis muscles. Alright, thanks a lot for watching. I mentioned the cluster of Wayner for cervical radicular syndrome in the beginning of this video, so you can go ahead and watch this by clicking or tapping on the left. If you like this video, please give it a like and comment below to support our channel. If you are new here, we appreciate if you subscribe to our channel and hit the bell icon to get notified once we upload new videos. Check the links in the video description for more useful resources. And as always, this was Andreas for Physiotutors. I'll see you next time. Bye.